So our positive employee number continues to rise along with the community numbers. So what is Cahuilla Delta doing to prevent an outbreak amongst the employees?
So we have, I know you've heard probably over the last 11 weeks a lot of talk about PPE, personal protective equipment, and we do have personal protective equipment, and we are working very hard to change habits and practices and give people the equipment that they need to protect themselves. So we have surgical masks, and everybody is required to wear a mask, and the surgical masks are required for everybody that comes in contact with patients because they are more preventative than a cloth mask. A cloth mask will also prevent spread in most community settings because you're not sitting in close proximity to people for prolonged periods of time. But the surgical mask is appropriate for healthcare workers because we have to be close to people. We have to work within 6 feet, sometimes for 10, 20 minutes, an hour. And because we don't know everybody's status because of the asymptomatic COVID that we know is a factor in this pandemic response. The surgical masks are more appropriate for protecting the transmission of what we call those respiratory droplets. So basically, the word is sputum, but very, very small that you really couldn't see, very small particles. It would be obvious if it was big particles, but we're talking about very small particles. The surgical mask will stop that transmission from the patient or a visitor or somebody to the healthcare worker because we don't have the option to put 6 feet of distance between us in the hospital. In our areas where we have COVID positive patients, this is the high risk area because you definitely have a concentration of COVID positive patients. We use N95 masks and we use gowns and face shields because more of those respiratory droplets are going around. They're definitely likely to be positive droplets. And there's more people in that space, so there's more of it. It still is, the respiratory droplets still travel 6 feet and fall. But what we do in the hospital that isn't done in other places is we do procedures that cause the particles to be aerosolized. So we kind of break them apart and they get a little lighter and they can travel a little further. So in those areas that we know that are positive and we know patients are having those procedures or even just anybody that's positive, we're using the N95s. Those truly are filters. They filter 95% of particles, and it's a stronger layer of protection in those COVID positive areas.
Yeah.
The outbreak, yes, we're trying everything within our power to prevent an outbreak. We have got distancing of people when they're eating, the enforcement of wearing the masks in all situations, especially in closed offices where there might be 2 people in there. Moving office spaces around so people don't have to sit so close for 8 or 10 hours, trying just to give some distance where we can, enforcing hand washing, and the mask though is is our primary methods in the facility. And then we just really ask our teams to be very accountable and responsible to what they're doing to prevent the spread, because ultimately it comes down to each individual and that ownership of preventing the spread. As we get more PPE, we'll continue to expand the use of it.
Right.